From the nonpartisan Maddy Institute and the California channel at the state capitol, this is a Maddy Policy Brief.
Welcome back. We're talking with the California State Auditor, Elaine Howe, about a recent audit her staff conducted on how the state monitors, or sometimes fails to monitor, healthcare plans offered under Medi-Cal. So if doctors are listed in a health plan directory, but they're not available, it would seem like beneficiaries then are going to have some real serious problems if they need to get their medical needs taken care of, kind of like a treatment delayed is treatment denied situation. So if a beneficiary complains, what happens?
Well, they try to call there's an Office of Ombudsman with Healthcare Services where people can complain and call and say, hey, I've been trying to use this directory for Anthem Blue Cross and the providers are not accepting new beneficiaries, or I'm running into issues. The problem we identified when we talked to the Ombudsman office and got some information is they are overwhelmed with calls. Part of it, I think, is because of the increase in the number of beneficiaries in the program.
And actually, from your report, you actually give a number. You said between 32,000 and 71,000 calls a month.
A month.
It's an incredible number.
Right.
So they're having a problem answering all those calls.
Absolutely. They're having a problem. A lot of people calling in aren't even getting through. They're getting a busy signal. They're not even able to reach an agent or someone who can assist them. Those that do get through, 50% of those are an agent never gets to them. They end up hanging up or trying to call back later. So a lot of concern with the ability for people who are already frustrated because they haven't been able to find a provider. Now they're trying to get help from healthcare services and they can't even get through the department.
It literally adds insult to injury.
It's got to be very frustrating for people looking to get health care.
And I think I was reading in your report that you were saying also the telephone system crashes frequently as well.
It crashes frequently, which means they lose data, because one of the things we asked healthcare services, are you tracking this information to determine whether or not you have sufficient staff to handle the calls, or whether or not your phone system needs to be upgraded. They are in the process of upgrading their phone system. But when it does crash, they lose all of that data. Perhaps they have been working with someone who called in, putting information in the database, the phone system crashes, it's gone.
And then the person says, but I gave all this information, start all over again, clean slate. You also talked about staff limitations too. I mean, they're understaffed.
Right, because as I said, for the calls that do get through, 30 to 50% is what the estimate the department told us. So they said about 25,000 calls is what their phone system can handle. So
and they're getting up to 71,000, so you can just do the math.
Right, those people aren't even getting through, but of the 25,000 to get through, half of those, 12,500 people, are not getting assistance they're not able to talk to a human being to try to get assistance.
And that's every month, and that adds up, and there must be a tremendous amount of frustration with folks. I mean, having Medi-Cal is great, but if I can't access a doctor, what does it mean?
Exactly.
Okay, so the Department of Healthcare Services is supposed to audit the Medi-Cal plans as required by law to do that. Are they doing that? Are they?
No, they're not doing that either. They're required to audit the plans on an annual basis.
Okay.
And what we found is prior to 2012, they weren't conducting any audits. But they hadn't conducted any audits at all. But in the last few years, they've tried to conduct some. The most recent year, 2015, when we issued our report in May, just a couple of months ago, they had audited 9 plans.
How big of a universe of the universe 9 plans is how much about?
There were 22 that they're supposed to audit on an annual basis, so they looked at 9, less than half, the most recent year. And a couple of years ago, they looked at 10. So they have not gotten anywhere close to auditing all of the plans on an annual basis as required by law.
Now, you specifically mentioned the auditing of Medi-Cal programs in rural counties. What did you find there?
Right, so that's where the Department of Healthcare Services actually contracts with managed care. And managed care is supposed to be
doing another state department is supposed to be doing this.
Right, and so they were conducting these, this was the quarterly assessment for the adequacy of the network. Do we have providers within the 30 minutes, 10 miles?
Which is a big thing, and you're in a rural area.
Absolutely. So the 28 rural counties were recently added to the contract, and at the point we had conducted the audit, they had not done any of those quarterly assessments yet. So the rural counties were not being served by the state of California at that point in time.
Just completely left out.
Right.
You know, it's interesting, I was looking at the numbers, and you said that the number of people affected, surprising, over 500,000 people.
Right. I mean, when you're looking at 28 counties, Don't ask me which ones they are, but
I won't.
28 counties. There, you know, even though they may be rural communities, there's significant population there that's not being served by healthcare services or managed care.
You know, it seems like healthcare services, these two state departments, and was it healthcare services and managed healthcare?
Right.
It's hard to keep all this alphabet soup together. But it seems like they do a lot of the same work. Can they be more efficient maybe by not duplicating each other so much?
Right, there is some duplication. We talk about that in the report where healthcare services we were talking about is supposed to annually audit the plans. Well, what the managed care has it on a 3-year basis. But when we looked at what healthcare services assesses when they conduct an audit and what managed care assesses, there was duplication pretty much throughout. There was only one element that was different.
So managed care that does it every
3
years could use what healthcare services is doing every year.
Exactly. We think we could eliminate that duplication. Managed care should rely on healthcare services. You know, more cost effective for the state.
Yeah, that's a good solution. All right.
For a more in-depth analysis of this and other public policy issues important to Californians, please log on to our website at maddyinstitute.org and click on the Policy Analysis tab.